As far as no mesh hernia repair, this is a hernia repair technique that is done on inguinal hernias or groin hernias, typically on one side of the pelvis or the other. This can be in men or women. It's much more common in men, but it can certainly be on either. This is a technique that I do that is a repair for this hernia does not use the permanent synthetic mesh. So most general surgeons that do this procedure either do this laparoscopically or robotically, or what we consider open, which just means making a surgical incision over that particular area. But most general surgeons do this with permanent synthetic mesh. It's like a woven plastic. It's almost like a screen door. It's like a flexible, pliable plastic, amounts to like a screen door type of structure. I use the tissues of the body in this area to repair hernias. Sometimes I do recommend patients use a fully resorbable kind of mesh-like product, but it's a fully resorbable product that actually kind of lays down a scaffolding or framework for healthy collagen scar tissue to grow into the area, which kind of helps to further kind of support the area while your body's own tissues can help to close off and repair the defect or hernia in that area. This technique and this type of hernia repair, there's somewhat limitations to it. So if patients are super active, so I've done some patients who do like competitive mixed martial arts or competitive elite athletes, those patients in those situations, I certainly do recommend the added use of these soft tissue support. And then sometimes if patients are significantly older or have had a hernia for a very long time, or if the hernia is quite large, all those things can really lead to the tissues being kind of stretched and weakened, and they don't really have by themselves really enough, in my opinion, enough strength and kind of staying power. So a lot of times in those situations as well, I'll recommend the use of this added product just to help support and prevent recurrence.